The topic is, of course, rural development, and as they have already pointed out, the perspective is from the beneficiaries of these rural development schemes. So initially we wrote the whole thing in Kannada, and then it's been translated into English. The report is available online. Of course, there are a lot of rural development schemes that are constantly floated by the central government and state governments. These 5 that we will be talking about are related directly to the lives of villagers themselves, and 3 of these, which is this Nirmal Bharat Abhiyan and NREGS and the Anganwadi, they are centrally sponsored schemes that probably exist across the country in almost all these villages. So the central government draws up a guideline, a framework, a methodology of how it's supposed to work out on the ground, and we'll also try and compare what the vision is versus what actually happens. This all started sometime last year, and the year was a drought year. A lot of marginal farmers were finding it difficult. There were problems getting fodder, finding water, finding wage income, so on. And so one of the things at that point that got me thinking is, what is it that we can possibly do to at least the few we know? And it seemed relevant that in this time of drought, maybe they could write about what they were experiencing, and maybe it would have a larger context in which it could be viewed, and that's how we got started. So coming back to the stories in them, so we're just trying to thread them all together. We won't get into the details of each of these stories, so you might feel that a lot of things are missing, but maybe we can get into that later. If we look at the issue of collective action by beneficiaries, right, we could pose these questions. When is it that collective action is necessary to receive the benefits of these rural development schemes? And when can you expect it? It doesn't always happen. When can you expect it? And of course, in a lot of cases, it doesn't happen. So the question of why it doesn't happen. So the first point is that the set of beneficiaries varies from scheme to scheme. It seems obvious, but the point here is that in some schemes like canal irrigation, you could have farmers from different villages having to come together, right, to derive the benefits of a scheme. So you could have inter-village collective action. You could have the entire village participating, which is the case with rural water supply. But in a lot of schemes, there is a very small group within the village, and these groups change. For example, the Anganwadi affects very young children in the age group 3 to 6. So it's really just their mothers, which would be a bunch of 10 people or a few extras, which form the beneficiary group, right? And it's not necessary that the rest of the village take an interest in what is happening to that scheme or that group. Similarly with NREGS, it's only households with job cards that are the beneficiaries. And in the NBA scheme, which is this total sanitation campaign, which is now called Nirmal Bharat Abhiyan, is just the households who did build toilets, not the households who didn't. So the set of beneficiaries keeps changing. That's one thing to remember. But when you look at a scheme from the point of view of the beneficiary, what they see is that there are basically 2 routes through which the scheme reaches them. One is through these line departments, and above them are the district officials, and above that is the state officials, and so on. And the other route is through the Gram Panchayat, which is this Panchayati Raj institutions. So the lowest level is the Gram Panchayat, and above that they are of course controlled by what the Zilla Panchayat tells them to do. So these are the 2 routes by which welfare schemes actually reach these beneficiaries. And in our stories, 2 of the schemes, the one relating to the Anganwadi and the other relating to canal irrigation, are run by line departments. I've just mentioned the district level and lower officials because some of these officials are what the beneficiaries have to deal with, either directly or through some representative or someone. So these are officials that the beneficiaries need to think about, or who will affect them in some way or the other. Thinking about the Gram Panchayat, this is just a photo of a Gram Panchayat. It's necessary to, I think, remember that it's a government office, because that's really how it transpires to the beneficiaries. And there are a lot of government employees. Presently in Karnataka, there's the Panchayat Development Officer who's sitting at the apex. There's the Panchayat Secretary, there's a bill collector, there's an assistant, there's a peon sweeper. It's a regular government office. There are also, of course, elected members. There's the Panchayat President, the Deputy President, and there are what are called Gram Panchayat members, generally about a dozen. This changes from Panchayat to Panchayat. But the distribution of power between the government employees and the elected members is not on par, certainly. So, for example, most of the authority of signing, approving and all that rests with the government employees, right? And the elected members sometimes have a say, can sometimes have an influence, sometimes they don't have a say at all. So that's how the distribution of power in this Gram Panchayats is presently. That's the background about these schemes. Now we come down to implementation. And the point really that we are interested in is what can happen? What if a beneficiary just decides to go alone and tries to receive the benefits of a scheme? What is it that might happen? Another situation is when there is a proactive GP member. What might happen in such a situation? And then we come down to collective action. What happens if that group of beneficiaries just decides to act collectively? This is the situation with this drinking water scarcity. In other cases, what happens is not only do you act collectively, but you try to involve an outsider also. In this case, the outsider was a non-political outsider. And sometimes you can have the MLA and the MP also on board. They could be working for you, they could be working against you. But collective action alone doesn't necessarily lead to desirable results. Sometimes you need that outsider. It could be a Gram Panchayat member, it could be an MLA, it could be an MP, it could even be a court-appointed advisor. That's what these stories show, and almost all these situations are covered in the report here. So we'll just look at all these stories in very briefly, right? Just to draw out the final conclusions. Let's assume that a beneficiary decides to go solo, right? Goes on his own. Let's say he's a small farmer and he has no details about the scheme. He has no backers, right? And he lives a little bit far away from the GP office. It's about 3 kilometers away. There's no public transport, so he has to either walk or take a cycle or take a two-wheeler, and so making repeated trips is a little bit of a, it's time consuming, it's a bit of a bore. But since he has no backers, he'll probably have to do that. The scheme is about constructing toilets. Now, since all his neighbors have constructed toilets, let us say, he knows exactly what is needed. There are just 3 steps to make a toilet. You make a deep pit, 6 feet deep pit. You line it with cement rings. Then you place this toilet chamber and you connect it to the pit. And finally, you build the walls, the roof, and the door. That's what costs the most. So he knows what needs to be done. But under the scheme, what is allowed and what benefits he can get, he, let us say, doesn't know enough about. There's no awareness generation and all that. What would happen? Now, typically, what happens in summary is that he makes repeated trips and he finds a lot of times he is confronted by the peon. The first day he goes, the peon says, look, you need to fill out a form, you need to bring an ID card. But anyway, we don't have forms now, so you go home, you come later. So he goes back and he comes the next day. He gives him the form, he fills it out, and then he says, no, but you didn't get your NREGS card, that's also needed. And then you need this PDO sign, and you need to come again. So he goes away and he comes back again, even though he might have some other work lined up for the day. You lose a large part of the day because you sit there and you wait until the official comes. So when he goes another day, he says, well, now the PDO is off in a meeting and he's going on leave for a week, so I don't know what to do. Now, because this farmer is let's say a street smart farmer, he knows that all these points, at all these junctions where hurdles are created, you just need to slip in some money and it will move a little smoothly. So at each time when he gets these kinds of responses, he slips in some amount, 100 here, 50 there, and all that. And of course, once he does that, the approach of the peon also changes. So one day when the GP secretary and the peon come, now the way this works, this scheme works, is that at various stages you have to take photos. Those photos have to be, the Gram Panchayat secretary has to approve that these photos are all right, and then probably upload it and do something like that. So when they come for inspecting the pit, they inspect the other pits, but they don't photograph his. They say, well, it's not the right dimension, it's something wrong with it. Again, he knows that if he has to get it done, he has to follow them and then, grease their palms a little more. Finally, he gets it photographed. So we move on rapidly, and he builds a toilet, but he builds it with borrowed money. And when he goes later to the Gram Panchayat office to get the financial assistance, again, this time the peon is singing a new tune. He's saying, well, the office computer is out of charge, something else has gone wrong. So you can see that in sum total, over a period of a number of months, he's spent a lot of time, a lot of money, and he's been through a lot of mental strain to try and get the benefits of this one scheme. This would be very likely if you tried to do this on your own. But in case you had a proactive GP member, proactive meaning you don't have to go and influence him, he's interested in delivering these scheme benefits to you, then the picture changes completely, because he gets these toilet chambers issued from the Gram Panchayat office. He takes all the necessary signatures. He ensures that all the pits are photographed when the secretary comes, and he's even able to influence the GP secretary to the point where there is the issue of people who had constructed the toilets a little bit earlier, maybe a year earlier or a few months before this scheme came into place. Now, should they be denied the benefits? The central government doesn't care. According to their guidelines, all that is not included. But on the ground, this is an important issue. Why should somebody be penalized for not having built it at this time, but built it earlier? So he is able to press the secretary and say, look, if you give financial assistance to any previously constructed toilets in this Gram Panchayat, then I insist that you do it for this village too. He's able to do that. And later on, when the financial benefits do come, he's able to tell the beneficiaries, look, come pick up your checks and so on and so forth. So you can see the picture is completely changed. I'm not saying this can happen in all schemes, but this is something that we encountered in the stories written in this report. What is it that, how is it that this whole scheme should run? According to the brochures, according to the Government of India and so on, there should be information, education, communication activities for sustainable demand generation for sanitation facilities. There should be extensive capacity building of the stakeholders and all this. This just almost seems completely irrelevant when you see what actually happened with the, the scheme in these two villages. There were supposed to be production centers and rural sanitary marts that were supposed to provide all these sanitary materials like toilet chambers, this, that and the other. And there was supposed to be a revolving fund, there was supposed to be... So this is what we see in all our brochures, but what actually transpires, it looks very different. And this is just an example of what the brochures... This is for Bharat Nirman, but it could be any other thing. I've just picked this up from official websites here and there. There should be a Gram Sabha meeting, there should be awareness and participation, and then there will be planning, and there will be a social audit, there will be grievance proposal. All this really seems like a non-existent world when you look at the stories we came across. I'm sure in some villages it's different, but this I think is more common. So we covered the case where the Gram Panchayat member was active. Now what happens if you act collectively as a group of beneficiaries? This issue of drinking water for the village, right, involves the whole village, and there's a good chance that you can get everyone to come together on this issue. I'd just like to describe what rural supply in a village, water supply in a village looks like, because perhaps some of you are not aware. This photo of the lorry is how a drilling rig looks like. It's a fairly heavy duty stuff, if you can see it in the picture, and the bore is being drilled at I think that's visible, that little cylinder at the bottom. So they could go as deep as 500 feet, 600, 1000 feet down this bore. That would cost, today's cost, it would cost about 1 lakh or so. Then the borewell, you put a submersible pump in, you put cables, and you put a starter box and all that, you fit it with all your electrical fittings, that will cost another 30,000-40,000 in today's day. Once that is installed, this the water that comes out of the borewell is fed to what are called cisterns. They're about 8 feet high and they can hold about 3,000 liters or so. These cisterns are not cleaned every month or so, once in 6 months or so. So you can't really take your drinking water supply from there. So what you do is, in all villages there were provision for a cattle tank. So the water comes into this shallow tank. So the water comes in through a pipe and you can use that as the drinking water supply, directly drinking water. The rest of it is domestic water for washing and so on and so forth. The point I'd like you to remember is that this borewell, this hiring a rig, making a borewell and all that is very common in the village, because a lot of people have private borewells for irrigation. So about half the people in the village will know exactly how to hire a rig, how deep to go, what kind of motor to put, how much cable you need, and they're able to do all that. But for drinking water you make a separate borewell, which is a public borewell and which is meant only for water supply. What happened in this village over a period of years is that the first borewell was dug in 2003. Before that, hand pumps were used, and the hand pumps were delivering enough water. People would fill their pots and go home. So when the first borewell was dug, 3 cisterns were also installed. But in about 6 years, the first borewell went dry. So a second borewell was dug. Now by the time the second borewell was dug, a lot of new cisterns also came in. Each cistern again costs about 20,000-30,000. It's not clear who approves of it and why it needs to be approved of and so on. But we'll ignore all that. So the second borewell also started failing. So what they did was, they lowered the pump right to the bottom. It helped for a little while, a few weeks, and then the borewell again, the yield fell. So 2 years later, in 2013, the second borewell was deepened, went from 500 feet to 1,000 feet, and they put a more powerful motor, and that too stopped working after a while. And finally, by 2014, which is this year, the solution was providing tankers each day to this village. Right? That happened for a few weeks. That died down, and then finally there was a villager who went and got permission to supply water from his private borewell. It's not adequate. People are still struggling and cribbing. It's not the best scenario, but this is what has happened. Now all these actions, with the digging of the second borewell, the problems with the second borewell, nothing happened automatically. At each stage, the people of the village, especially the women, had to get together, protest, call someone, try to do something. It didn't all happen automatically. Again, I'm not getting into the details because the details are there in the report and we don't have too much time now. So essentially, when they tried to act collectively in the issue of drinking water, domestic water supply, it turns out that in this sector the GP member has no authority. They tried to complain. The GP member also tried to do a few things, but really couldn't do anything. They're not given any power to do anything. So the only recourse is to complain to that PDO who is sitting in the GP office. Now in the GP, as I said, there are 10 or 15 villages that are under that GP. Now the PDO has to distribute his time not just for drinking water, for various other schemes and so on and so forth. So his attention is not on the problems of a particular village, right? So they repeatedly have to call in, they have to complain, and he typically either ignores what they have to say, or he delays, or he does some stopgap measures. In this case, for example, after the second borewell was drying up, just put a third borewell. That would seem obvious, but at all points he seemed to be stalling all that. And you can see that by the kind of responses he was making. Every time people went to him and said, complained. First he said, well, we'll find water for you within 24 hours. Nothing happened. So they went back, they complained, and they said, look, you have to either deepen the well or dig a new well. Give me time, I'm going to talk to my higher ups. Nothing happens. Then finally this year they said, well, you really need to dig a new borewell. And he said, well, the general elections are around and the model code of conduct says no new borewells can be dug. So he said, I promise to send you tankers. And he sent tankers for some 2 weeks, and then that came through, and finally his fellow villagers were permitted to supply water. Since this story was written, there have been more adventures. In fact, the collector himself came to the village to see how bad the situation was. They went on a dharna, they got on TV and so on and so forth, and they tried getting another borewell dug and all. But the point really here is they are acting collectively, and yet they are not really making much headway, right? Because the PDO is simply able to stall them without giving them clear answers. Or what is the problem? Why can't you dig a third borewell? Or what are you allowed to do? What are your powers? It's not clear. In the next scenario, we talk about a situation where they act collectively, but they also have the help of an outsider, right? This is the Anganwadi building in the village, just a small room, and inside that there is an even smaller food room. There are about 8 or 10 children, and to run the Anganwadi there is one Anganwadi worker, right, and a helper, because these children are very young, wash their hands and keep them clean and so on and so forth. What are the facilities that this Anganwadi allows? This is an ICDS scheme. It's been running for 40 years, and the idea is that you provide nutritious food for the children. You sprouted gram, ground nuts and so on. And there's a scheme by which villagers are permitted to volunteer vegetables, rice, pulses for the children's meal. The children are there between 10 and 4 in the morning. There should be soap, and there should be clean drinking water, there should be learning materials, there should be toys and so on. So this is what the Anganwadi is supposed to provide. In this case, in this village, what happened was there was an incompetent Anganwadi worker. She was handicapped, she was not keeping any records, she wouldn't come regularly and all that. So at one point parents got fed up, so they tried to change the Anganwadi worker. What happened then? There were two steps. One was to dismiss the worker, and the second step was to find a replacement. Now all this that I've condensed into just this one page has taken place over a period of maybe 1 to 2 years, right? So initially they wrote complaints to the official saying, we want this Anganwadi worker dismissed. So the official came and he reprimands the worker and says, I'll fire you, but fire her, not here. But nothing really changes. So again, repeated complaints. She was physically handicapped also. She had been there for many years, but at some point I think parents really got fed up by the poor quality that her service was. So the official kept not taking an action until they came together and threatened to lock up the Anganwadi. It's at that point that the official came and he forced the Anganwadi worker to resign. So this itself took more than a year. Now once that had happened, you have to find a replacement. Finding a replacement, he made a temporary arrangement. That is, the Anganwadi worker from the nearby village would come here and do it. Initially she came regularly, she tried to put some methods in place and so on. But she began to come less and less often. She had to go to her own Anganwadi, she had to come here, she had to open the food room, give rations, do this, and beyond a point I guess she thought it was too much. So the parents again got together and they called and they wrote to the official, and of course he had answers. He said, look, a new worker is no vegetable to be picked off a shelf. It sounds like a valid point, but when you consider that he is not showing any interest in what is happening to the children and running of the Anganwadi, and the fact that there was already a person who was waiting to be transferred to this village, right, because her in-laws were in this village and she had been trying for 1.5 years, all that doesn't come through in the answer that he provided. Finally they decided to call. They found out that there is a court-appointed outsider. The Supreme Court, under this Right to Food Act, has appointed advisors in each state, and this advisor from Karnataka state was contacted and he sent his representative. So of course they have a lot of power. So as soon as this man came to inspect, the official came rushing and he said, no, I am going to act, just give me a little time. And of course he sat on it, he didn't do anything. So even though the outsider came and made a fuss and all that and talked to his superior and everything, nothing really happened. So again they had to complain to the this court-appointed outsider and say, look, this official is not doing anything, he's telling you this and he's doing this and something like that. And finally this transfer was effected. So they were acting collectively, but they needed that crucial outsider. In this case it was not a political person, it was not a Gram Panchayat member, it was not an MLA or an MP, But a court-appointed advisor seemed to have made a big difference here. Otherwise, this case may have dragged down much longer. This last case, this last but one case, I won't really dwell on. It was the topic of the sharing session 6 months ago. It's a very long story. It runs into a lot of slides, so we won't get into that. But essentially, this is a branch canal. Can you see that? How do I point? Yeah, the one at the edge in pink, that is a branch canal, and it is releasing water to this sort of grey colored canal, right? Yeah, and that is a distributary. And you see at that junction there's a little black EBC is written over there. Now that is the escape gate. So if the escape gate in the branch canal is raised, then water is released to this distributary. So this was the drought of 2012. People were really struggling for water, for irrigation, and they needed water in this distributary. Although distributaries above this and below this were receiving water, this distributary was not receiving water. So a lot of farmers from at least half a dozen villages got together. There are 4 tanks, irrigation tanks, that were fed by this distributary. So they all came together, they met the MP, they got him to talk to the irrigation department and somehow get the water released. It was a big drama. It lasted about 15 days. They got a little bit of water, but not enough, and so on. But the point really here for us is that they did act collectively, but they really needed this MP to act. So the MLA was trying to do just the opposite. He was trying to ensure that the distributaries wouldn't get water. So this was an added complication. But if the MLA and the MP had not acted, there would have been nothing. There would have been no drama. There was no point in getting together collectively. Nothing would have happened in this case. So there were a lot of important people in this drama. There were the farmers from these villages, 150 to 200 men. There were minor actors, farmers from smaller tanks that were not officially supposed to get water from the distributary, but they were also waiting for their share because they were desperate. Everybody was desperate for water. On the other hand, there were farmers whose farms were right next to the canal as the canal entered, at the beginning of the canal. So they would always get water, some of them even without electricity, because you just put a pipe into the canal and you're getting water. So they would have always won. But unless these political players had come in, this drama would not have got off the ground, because the irrigation department was also involved. So I won't get into the details of this, but essentially the MLA, the MP were necessary, right? Without that, nothing would have happened. Now, the curious case in these stories is about NREGA. We hear so much about it in the news, and one would really think that in a drought situation, a lot of people who are having trouble, getting wage labor and all that, finding work as wage labor, would really take to it. But it turns out that that was not the case here, and it is a little perplexing until you realize that, for one thing, they were not given clear awareness. The GP secretary, who would have known a lot about this scheme, let information out in bits and pieces, not giving the full picture and on. And the job cards are not with the beneficiaries at all. They're just sitting in the Gram Panchayat office. Okay, and every time, even if you wanted to ask for it, you could, you won't get it. They'll just try to delay and say something or the other. So there is no instance of timely payment of wages under NREGA in these villages, these 2 villages that we know of. And of course, the work is hard, and the hard labor and the wages are also unattractive. In fact, just a day or 2 ago, I read in an article that the Karnataka High Court has told NREGA that they should follow the norms for Karnataka. Karnataka has a minimum wages act. Now the NREGA wage is lower than the minimum wages allowed in Karnataka under this act. So what people would get outside of the NREGA is people who are willing to work, they would get 250 a day, whereas the NREGA is giving them about 175, right? And with NREGA, you will have to take photos, you'll have to fill out a form, you'll have to make repeated trips to the GP office. It just doesn't seem to be worth their while. And so what really happens is that the GP officials and small contractors collude. So the money received by the Gram Panchayat under NREGA is sort of shared between them. And the point really is the farmers, the wage laborers and the small contractors, there's no ill will between them. You see, in fact, the contractors keep telling you that I can't do this because there is no labor available. Even if I offer higher wages, nobody wants to come and do this job. And if you go to the Gram Panchayat office and say, look, did anyone approach you with a job application? They say nobody came with a job application. I don't know, there could be more to this, but from the beneficiary's point of view, when you look at this story, this is what emerges, right? And there is no ill will because the contractors know that they need the signatures of the job card holders, and they know that the money will go to the account of the job card holders. So the job card holders say, well, what is in it for me? And so yes, he parts with a little bit from the profits that he makes. So the job card holders are not particularly upset about this arrangement, right? So this is what happens when they don't act at all. So this is really the result of this kind of analysis of these stories, that in each scheme you have different set of beneficiaries. In canal irrigation there are farmers, in Anganwadi there are young children, and the actual involvement by these beneficiaries, if you classify them, you can see that in two of these cases, in NREGS and NBA, there was no involvement at all. The case about that small farmer is a little hypothetical because nobody, by now people know that this is what you will expect. So why should you go through this process at all? So it was a sort of idealization of the whole thing. But in other cases, what they are allowed to do, what is the involvement? They can make oral complaints, they can make written complaints, but beyond that, there is no scope. If you look at that last column, that is provided by any of these schemes for the beneficiaries to do anything more apart from complaining and this thing in many of the schemes. In the case of the Anganwadis, it is interesting that not only is there a mothers committee allowed, but that committee can monitor, it can supervise the running of the Anganwadi, and any small problems they can handle, and they receive grants from various, say the health department or so on, and they are allowed to spend those grants the way they want. So there is a committee, all these powers are provided by the scheme. So in that sense, the Anganwadi is giving some power in the hands of the beneficiary, substantial power. Whereas in NREGS or NBA, yes, you say we should have a social audit, we should have the Gram Sabha collecting and talking, but these are all non-existent things. What is the point in saying I give all these powers which have, you don't give them any authority, you don't give them any authority to take some action of some sort, handle some funds, right? What is allowed under NREGS is that if there are irregularities in the work, you can request inspection of the work. As a beneficiary or as a non-beneficiary, you can always say this is not being done well. So that is a problem which the contractors always have to keep in mind. Anybody can complain at any time. But that apart, the schemes, the way they are designed, there's no potential space for involvement. It's another issue that the villagers will actually use that space provided, but when in many schemes you don't even provide that space, or you provide imaginary space about some Gram Sabha acting or something else. And in each case the result was a little bit different. In the canal irrigation case, some water did reach, but it was not adequate because of many other problems. In the Anganwadi case, the Anganwadi worker was changed, that did happen, but there are still some problems with the Anganwadi, and we'll not get into that right now. Under NREGS, a lot of jobs were completed. It's not as if nothing was done on the ground. Jobs were completed, but not through the route envisaged by those who had designed the scheme. In the case of NBA, in one case there was a proactive member, and he ensured that the financial benefits reached many of the beneficiaries in the village. In the other village, right, there was no proactive GP member, and many of the beneficiaries are still waiting for the funds that are allowed by this NBA scheme. In the case of the water supply, the scarcity of water still continues, even though they all got together, acted collectively and so on. So really the take home from all these stories with regard to collective action is that it looks like collective action alone is not enough. collective action by the beneficiaries, you need an outsider, the way the schemes are designed right now. Now, this outsider could be as low as a Gram Panchayat member or could be as high as an MP in political terms, but it could also be a court-appointed advisor who is able to ensure that some change is made. It doesn't always have to be a political person. So really that's one of the take-homes from the stories that have been written here. So going back to the original questions we had, when is collective action needed by beneficiaries? It seems like almost always. Under whatever schemes we are devising now at the center or the state level, it seems like sole beneficiaries cannot go single-handed and try to get anything done. It seems to require collective action. And when can it be expected? We have seen that, for example, in NREGS or even some cases of NBA, nobody really got together collectively, right? But when they are pushed to a corner, or when the perception of injustice crosses a threshold, this was the case with canal irrigation, where other distributaries were getting water but they were not. Now if no distributary had got water, they might have kept quiet. But when you see patent injustice, and it's little more than you can take, then I think you can expect this kind of thing. In the case of Anganwadi also, that incompetent worker had been there for more than a decade. They did nothing. At that point there was no awareness. But at some point, when there was some scheme floated by the state government giving the girl child some funds at birth and things like that, and she was messing up all the records, it just got too much. So that's when you saw them acting. Reasons why it does not happen in some cases, one is of course schemes rooted through the Gram Panchayat, for example. Gram Panchayat doesn't handle just development schemes. It handles all kinds of things. If you want a caste certificate, you want an income certificate, you want your electricity connection, you want something else, you have to keep going back to those officials, right? So if you create a ruckus and you create trouble, even if you act collectively, in fact, that was the problem with this rural water supply. They got together, they acted collectively, and they had a dharna, and after that the PDO refused to do anything for anybody from that village going there, saying, you have acted wrongly or whatever. So one is of course they stall and they non-cooperate. You just make life more difficult for these people. But it's also, and this my colleagues who are writing these stories repeatedly pointed out, is the perception of what is a good life has changed quite a lot over the last 2 decades. And if you look at their world, I'm just calling it our world now, in these villages, there is of course a big place for God, right? At the start of any kind of undertaking, whether you're digging a bore well, you're ploughing your field for the first time this year, doing anything of that sort, you do a puja, you remember the gods and so on and so forth. And the notion behind it is, well, if I'm doing so much for the gods, right, won't they smile on us? We're doing so much for them. Then on one hand, there is this whole issue of loans. Now people are recklessly taking loans, right, for what they perceive as the good life. A TV, a motorbike, the latest cell phone, these are all musts almost. And children, even people who cannot afford, would like to send their children to convent schools. They want English education, even if it's a pathetic school in a local town which nobody cares for. And of course celebrations. They have to make grand celebrations and spend it. So for all this, they're willing to. They do take loans. They do take loans for drilling bore wells also. Yes, they do. But their assumption in all this is that they can pay back the interest. They're not worried about the principal. They say, well, we have areca nut, we have coconut, we'll sell so much and we'll make so much this year, so I can pay the interest and I'm not going to worry about it. So where in all this does the government schemes fit in, right? To be frank, they are heavily dependent on them. Various schemes, right, from water, electricity, housing, and so on and so forth. But they take very little interest in them. I think they are very distracted by all these other things that they are doing, and somehow it doesn't seem to matter so much for them. Even in that case when canal irrigation where 200 people got together, it was a 15-day drama, and by the end of the drama there were half a dozen people who were trying to still keep it going, acting. So this, they're not somehow taking enough interest, and that's possibly because their perception of the good life is very different. They are distracted by all this, and I think that has to do with the image that they are constantly receiving through TV, through media, through people who come from the cities and so on. I think it's really, a culture has changed in just 2 decades, because 2 decades ago people were much more careful about taking loans and so on. So if you ask them, look, there's a prolonged drought. This is the 3rd year we are into a drought, right? And we had very poor rains this year also. And there are mounting costs, because you're paying for your cable TV, you're paying for your, maintaining your motorbike, you're paying for your bore wells, you're paying for your celebrations. What about the future? What are you thinking about? They say, look, don't worry. The God who is looking out for us, He will look out for us all. Right? And this is not something I'm making up. This is the story that the story writers insisted that this is how it is. And they feel it's all very obvious. I thought it wasn't. I think we're not, in many of our debates and talks, we don't take this into consideration, that their mindset has probably changed in very drastic ways. But this is just a reminder of what we are talking about. This is what the area looks like. This is where we are, and just recent. So with that, I would like to end. Thank you.
Saying something like this at this point of time seems like asking for trouble. But rights-based development, where all, let's say, civil society work, if not the government looking at development as rights-based development, if all of it were to be centered around just better implementation of schemes. Let's say all NGOs in this country stop implementing programs of their own and only focus on convergence and implementation. They appoint their frontline people in all villages who are the people who've been, let's say, educated about guidelines, schemes, who can access, who cannot access, which way to access, and so on. I think just that is worthwhile, rather than, there's of course some innovation required, where some schemes have not been designed at all, where some schemes have been designed wrongly. You certainly need NGOs to pilot things and implement certain things themselves. But I think if the rest of the NGO world just focused on having even 1 or 2 functionaries per village to access schemes and get them implemented the way they are supposed to be implemented, I think it's a worthwhile effort.
More than injustice, say a crisis situation, either a drought or a flood, and a direct relationship and understanding of that relationship. And also the issue of the individual sometimes, the outsider playing a catalyst role, as it were. So the question specifically, there are 2 questions. One is, the 3 categories you identified in all ways were kind of state mandated or statutory authorities, either a GP member or an MP or a court appointed. So I guess this is just the limitation of the study, but do you have any thoughts on a person like you, who's an NGO or a well-wisher or an activist? What happens? Can that person also do those kinds of things? And whether you have specific illustrations or instances of that in your case? And the second larger question also links up to what, there were 2 or 3 things you said that which also points out that there is a change of a value system. And I'm wondering, where is that conclusion coming from? Maybe communities and rural India, all of us were always like this. It's not that we become more so. Perhaps, like Kavita said, there's more money now. But what I'm asking is that some empirical also basis to come to that conclusion that they don't care anymore. Maybe they were caring earlier. Maybe they were never caring in that sense. But maybe the crisis is much larger today, so it seems. So this is just a thought that came into my mind. Because if there is that case, then both the interventions and our understanding of that might change. 2 questions, please.
Actually, I would beg to differ with Kavita a little bit here. The reason why that last part came in, that last slide came in, was because of this, I thought if all these schemes were running perfectly well. If you could have very good, well-designed schemes in which beneficiaries are given some space to get involved in all that, what would happen then? And I discussed something like this with them, and the answer really from these stories themselves comes out that even if they were well designed, even if they were easy to access, you would still face apathy and certain amount of indifference from these villagers, because of this. And why, where is the source of this indifference? It comes because their mindset has changed a little bit. I mean, otherwise it's difficult to explain NREGA in some sense, why they just didn't come forward. Some extent you can understand, but they might have pushed a little more if it really mattered to them. It also came through, I think if you look at the report, which I have revised since you looked at it, you'll I've tried to show why it's important to keep this in mind, that this mindset has changed. And the point really is that even 20 years ago, the mindset was different. That people hesitated to take loans in their grandfather's generation, and there was a lot more cooperation. They hardly needed any government schemes, not that there were many then, except for PDS, which was there. They didn't need any of these schemes. Today, every family wants to get registered as BPL, wants to access the PDS schemes. It wasn't like this 20 years ago. So the change is quite rapid, given their own assessment of it.
In the drinking water story, you had said that the official was not proactive in terms of giving providing water. Is it because there is a lack of awareness towards the rules that exist? Because from my experience of working with the government of AP, in Guntur district under Principal project, the government officials, line department officials themselves are not aware of what schemes are available. So the joint collector had to instruct the line department people saying that get details of all the schemes that you have, and they had to have an awareness camp in our R&R centers. So at one level it is about not having the willingness to do something. It is also lack of
knowledge. Officials themselves not being equipped.
Exactly.
As I said, what I presented here was from the beneficiary's point of view. If you manage to contact some people in the Gram Panchayat office, they will tell you a whole litany of problems that they have, getting funds from the Zilla Panchayat and so on and so forth. But in this particular case of rural water supply, my guess is the PDO knew more, because he is dealing with a number of villages, right? And this is also, I found great difficulty, just trying to find out as an outsider, what are the procedures, what are the rules? Is he allowed to dig a third borewell? Is there some restriction because the population is below some amount? How does it all work? And there's nowhere you can go to get this kind of information. So we really don't know what was happening. So it's possible. I think there are cases in which the officials themselves don't know, they're not aware. But my guess is that maybe in drinking water for the village, perhaps there's more to it, not just a lack of awareness.
In the recent past in India, schemes that have evolved out of statutes, NREGAs for instance, which came out of NREGAs, wherever civil society has put in extra efforts to create the law first and therefrom the scheme, accountability mechanisms have been inbuilt, grievance redressal mechanisms have been built in, including the RTI legislation and so on. So I think there is something to be said about schemes having to be embedded in laws. One, because schemes are usually government schemes, they are not usually embedded in laws. So you scrap,
you keep changing, modify.
Some evaluation is done by some market research agency, some Dhanalakshmi scheme that used to be there for girl child. 2 years later they say, we have piloted, we didn't find it useful, we've scrapped it. So schemes come and go otherwise. So we do need well-devised schemes that come out of laws, that's one thing. Similarly, all laws also need schemes to back them up for their implementation. That doesn't happen, especially in the empowerment
RTA
sort
type,
of
RTA
laws,
type.
Dalit rights, disabled and their rights, women's rights and so on. They're not backed up by schemes. The law is drafted, but you'll have no one to implement, let's say, the Domestic Violence Act. You don't have those monies set aside for the officials to be appointed, those kinds of things. The other is all laws, once they're created, for schemes also, within the law certainly having clauses both for the social audit sort of mechanism, where there are institutional ways by which people are empowered to act when things are not happening the way they want to, as well as grievance redressal mechanisms which put accountability, which means that if you don't act within 15 days, this is what will be done within your line department to you. In NREGS, for instance, the official is supposed to pay up. In
But he
RTI,
doesn't-
you're supposed
he
to
doesn't-
pay up if
he
you
doesn't
don't
give
do
you
certain things.
when you go with the job application.
No,
and he doesn't.
no, but I'm saying at least those are the spaces that have to be built in. Additionally, you will need the players
Outsiders.
to invoke these things. And I think we've got to see this as a game that will continue for all time to come. There's never going to be anything like perfect governance. It will require citizenship to be awakened all the time. Awareness, guidelines, knowing how to access, struggling, protesting, doing all of that. With the system itself, the institutional as well as the statutory, the scheme guidelines, all of that being tweaked somewhat for those spaces to be built in.
Normally there would be some collective action on their own. We have just seen a collective action for accessing government programs. Wouldn't it be interesting to look at collective action that's initiated by themselves?
As initiated, I think in that sense, questions like building temples, looking
Yeah.
at religious...
Like conservation, for
ordinance.
example, which he was mentioning.
Saving water or
Saving water,
ecological
no.
issues.
Saving water, not yet.
rainwater harvesting
Irrigation
or whatever.
case study, they did initiate
Yeah,
something themselves.
it was the irrigation.
By
Yeah, because it was a
That
drought.
is what
They were really desperate at that point in time.
Yeah, but that was also to access the water from
Access,
outside.
yeah.
Something
So-
of doing on their own.
So on their own, what I have noticed is mostly relating to
Religious
building the
things.
temple, or in that sense, temples seem to have the ability to get some collective effort through, but their own interests and are very different.
Statues also.
Yeah.
Collective action is not in a village but at a mandal level. But it's not resulting in
Any change.
So, because collective action is better than an individual action, yes. But even the collective action with an outsider also is not resulting. And like you said, an MLA is also not resulting. MLA gives us an assurance, he comes to the meeting, okay, when I come to power tomorrow, I'll solve your problem. Now, the minister comes to power, and we as MLA have stopped against come to our meeting. Now he says, I assured you when I was an MLA, but now I'm minister, I can't do it. Clearly told us in this words. I was an MLA when I told you, now I'm in power, but lot of presence on me, I can't do it. He literally tells us. So there are a lot of other dimensions in individual which we are articulating.
I agree with
At
you.
what
I
level?
think this is not a comprehensive set of cases. I'm just saying that these are possibilities and these happened in these set of stories. There could be various possibilities. I agree. In fact, in that canal irrigation case, the presence of the outsider, the MP, the MLA, did not really ensure that people who desperately needed the water got enough or got it in the right time. So yes, I agree. But I can clearly see that without that, even that much would not have been possible. But certainly the cases you cite that you promise it at one point, later say I can't do it now. This is definitely possible. And I think all that also has to do with this initiative to volunteer. It dampens when you deal with such situations. The next time around, you're not willing to go forward, right? You constantly
Can't keep up the same tempo.
Yeah,
all
you
the
can't
time.
keep up the same tempo. So that may be one reason why there's a lack of initiative.
And the term used all the time is the beneficiary. And I'm only talking about my
weavers, and these are people who are organized into cooperative societies, so they are, which are membership-based organizations. So the weaver is the shareholder there, and at least now we work in 10 to 12 districts. I have not come across in the course of a decade weaver not being aware of the scheme or aware of what is their entitlement from the government. Generally they are very aware, and they are also aware, like you were saying, an individual when he approaches at different levels how they have to pay up from there. So what the management will siphon off, what the department officials will siphon off, what will come to the weaver, those calculations are perfect. They know that. You know the allocation, you know how much will come to you. All these things are very clear. What is very troubling is what is happening in weaving. There are lots of issues. Over the decade, we are seeing different problems coming up at different times. And weavers in each region are very aware. If you don't strengthen that, weaving will go, or it's going to affect our livelihood. But there's so, the word you use, there is an apathy for voluntary initiative or action. They wait for an action to be initiated either by an NGO or by the state. Somewhere the word beneficiary sits so oddly in my head when I'm thinking, because that's what I think everything, people, they're not citizens when you're talking about citizens and claiming rights. There is so much of that thing about killing voluntary initiative. I don't know, because even from my work I keep wondering, are we also part of